Welcome to the RADECT Health Podcast. Today we have Ashley Cutler. She's a social worker, and she'll tell us her background. Uh, Tell us a little bit about yourself and where you got your degree and how you ended up um, becoming a social worker, Ashley.
Sure. Hi, everyone. My name is Ashley Cutler. I am a licensed clinical social worker, and my background started with human services. I was in college, and like a lot of other people, decided I wanted to go into another field. I was actually going to go into computer science, and I did not like it. So I went and talked to the guidance counselor, tried to get an idea of the things that I like to do and I was passionate about. And one of the things I said was that I like to help people. And so she pointed me in the direction of human services, which is basically working with nonprofits and servicing people that are connected to nonprofits. And so from there, I learned about social work and what it was and all that is in that field. And I thought that that was a good way for me to get specialized, but also have flexibility. So from there, I went to social work school, and my undergrad was at York College as TA. But graduated there, went to the University of Maryland School of Social Work, and that is where I got my master's in social work and my training to become a clinical license.
So, can you describe what you wish people would know what social workers do? Because they do a lot. So it's always
Yeah, there's a lot of misconceptions about what we do. And I think the biggest thing is that social work is such a large, diverse, and flexible field. We don't all do the same thing. And just because the work may seem very simple, a lot of times it's not. There's more to it than just listening to people. There's more to it than just helping people coordinate a few things. It takes a lot of problem solving and a lot of mental energy. And it takes a lot of work, you know, on emotional, physical level, and also a mental level. So you're using all of what you have to help people and to support them. And that takes certain qualities, it takes certain characteristics, it takes patience and it takes empathy, and it really takes a lot for a person to step into those shoes and say, I am willing to help others for a profession, or I'm willing to support other people as a profession. So I think that that's really important for people to know about social workers. Even if you've had bad experiences with social workers, a lot of times people go into the profession from that standpoint of wanting to really help them.
now you grew up in Baltimore and you're now working in Baltimore. So what have you seen?
Yes, I did.
So what are you seeing now as kind of some of the being a social worker, what are the benefits you're able to provide to the lower income settings that you're working in?
I think I see the connections for me have been the most meaningful in terms of working in Baltimore and being able to build connections and relationships with people that otherwise I wouldn't have been able to if I didn't work with them. So I think that that's really important. And there's different initiatives, there's different things in Baltimore that people are doing, not just social workers, but also people in the community, advocates. There's a lot of men that try to step up and do things for the children in the community. And so those things aren't really as publicized. They're really not as talked about. And so when people think of Baltimore, they think of, this negative connotation that comes with it. But there are some things that are going, and there's some things that look really great, and that there's people that are motivated to supporting the Baltimore community. So for me, I feel like the connections and relationships that I've established with people, that's been really rewarding. I think that that's helped because not everybody has support. And so if you can be a part of their support system, that does a lot people.
So a lot of people. How tell me about how you patients find you.
Yeah, so prior to, I was working in a community health center, so a lot of our referrals came from many different places, a lot also from psychiatric facilities or hospitals. We're very well known or connected to helping patients in the outpatient sector, which basically means they're not in the hospital, they're not in an institutionalized setting, they're not in a place where they're receiving their psychiatric care and living in the same place. And so that was how I mostly got those referrals. Now I work with a telehealth company called Hurdle Health. So someone can reach out to Hurdle, they can ask about me, and they can get connected. And it also just depends on availability in terms of when people come and they don't know who to choose. There's bios for all of the therapists. So you can look for what you are seeking, or you can say, I want somebody that's specialized in this, or I want specifically a black male or black female therapist. I want a white male or white female therapist. Or you could say, I want Hispanic, I want Asian therapist. So you can specify if you want someone of the same background or somebody that's culturally connected to what you are. And so a lot of my current referrals that come in are people that want to work with a black female therapist. And so we then get connected, see if it's a good fit. And if it is, I continue to work with them. If it's not, then they'll work with another therapist.
Now, you've worked in the community health, and what were those challenges that you found as a social worker to help people? Because you are within a system, and there's both positives and some things that could be improved. What were some of the things you felt could be improved?
I think the frustrating thing was operating within the system at times. And what do you do when the system is doing something or the system is maintaining something that you don't agree with? And what happens when your values and what you hold to be important is not the same as what the system holds important? And so those were times where it was really difficult. There's a lot of emphasis on ethics in social work because there are situations that come up where you're at a crossroads with what you believe and also what's going on maybe in an organization, what a coworker is doing, those types of things. So we do have some kind of guide of how do we deal with ethical situations, but it's a lot more difficult when you're actually in them to navigate and figure out what's the best choice, what's the best thing to do. And I think another big factor was the things that I felt like I couldn't do anything about. So having people that could sit in front of me and tell me some really difficult things that they're dealing with, some major stressors, and I could understand why they felt the way that they felt, but it wasn't something I could necessarily do something about in that moment. And that if I had done something about it, I would have had to take all my time and attention away from my other responsibilities at work, and that just wasn't something that I could do. So at moments feeling stretched too thin because all of the problems that I was seeing and facing were bigger than me, and some things that required systemic change. And so it's that idea of feeling limited in your work and feeling boxed in, and a feeling of hopelessness or helplessness, I think, that comes for both the person that is experiencing it and also for you as a professional. They're coming to you for help. So you want to be able to help and support them with everything. But there were times where that wasn't realistic, wasn't practical. And there were times where I couldn't do anything. And that was really hard to know that and to sit there and continue the work knowing that I couldn't really fully help this person the way that they needed or the way that I wanted.
Was that primarily an issue with access, or was that other resources that you'd like to see a social worker have access to, or have the ability to have available to you?
I think sometimes it was access. Sometimes it was also if a client was waiting on a system or waiting for a service, waiting for something to happen, and it wasn't happening at the time they needed it to. So it could have even been like medical care of, needing a surgery, and there's certain things in place that prevented the surgery from happening, or needing immediate care, and having to think about, can I afford to get to this place? You know, can I do this? Can I do that? Who's gonna, be with my animals while I'm gone? So for people that lack support and have more difficulty getting around, and it's a lot more difficult to plan out certain things that in my mind would have been very simple if they had additional things, but it becomes more complicated. And so it was the point of being, frustrated with that. And I think just a lot of the resources necessarily aren't up to date when you're searching for them. So people could be out of funding. Um, it could say that this program exists, and it's virtually hard to get anybody on the phone to actually get someone enrolled into a program. There's resources that aren't talked about. They're nowhere to be found unless you know somebody that is connected to it, or unless you know somebody that's actually in those services. So the information isn't always there and isn't always easy to find to connect the right people to the help that is there. So there was that discrepancy and that disconnection. So it just made it very hard to get people connected to something that would actually help them in the care that they need.
You also got to address many different issues across many different people or many different challenges. And what was it like working with substance abuse people? And what are the things that you found were both challenging as well as where you found success working with that community?
So substance abuse is one of those things that, regardless of where you're working, you could possibly encounter. So I did work with people that had experienced substance abuse and were getting treatment, not just through us, but also getting additional, specifically substance abuse treatment that could support them. And so, that really makes a difference to have a team or a group of people working with them specifically on that. And I just think you have to have patience. You have to have um, care for what people's stories are, and just being open to letting people share what led them to where they're at. And that goes a long way with people for being able to share their story, because a lot of times when it comes to people that are diagnosed or experiencing substance abuse problems, there's a stigma that's there. There's a stereotype. There's the ideas about people where automatically they're getting judged right off from the beginning. So it's very important to establish that early on, because otherwise you can run the risk of judging someone. And whether you're aware of it or not, that does a lot of harm.
Well, not everybody you saw, Ashley, is always looking to receive mental health. Some people, they've been through the system, they've seen mental health, they've been through the healthcare, and they have a stigma. This doesn't help. How do you work with those people, and how do you help them, and especially within the resources that you have and the time limitations you have?
I just try to put my best foot forward and try not to perpetuate the things that are problematic in the system. And I don't always succeed at it. Sometimes I'm right there perpetuating things, but I try to be mindful of what I'm doing. I try to be mindful of how I'm interacting with people, and just basic kindness goes a long way as well. A lot of people don't think about that as being a big part of working with people. But if you're interacting with people, you know, Of course, there's some people that are not going to receive the kindness and they're going to be, in the way that they feel. But a lot of people appreciate it. And so that I think helps with the stigma. Um, because if you're being kind, then you're more likely to see that person for who they are or as a person versus a statistic. And that you're taking the time and there's thoughtfulness behind it. So I think that that is something that's very essential. And then also, I talk with people about those things and the things that they see. Unfortunately, the healthcare system and mental health care system have traumatized people. And I'm not going to lie to people about that if we're having conversations about it. So we would talk about some of the things that were really messed up or how they were being treated, or sometimes they would even come back for feedback and say, hey, do you think that this is not right? Do you think that this is because I'm experiencing this? Do you think it's because, and we would have this conversation so that they had some additional feedback and it wasn't just what was in their mind. So having those conversations, they're unpleasant, right? And they may not be something that we want to have, but they're necessary and they're very important. And if we don't talk about the stigma, then how can we address it?
So that comes back to another issue is that the idea of mental health is you have a psychological disorder that you can diagnose, and then you provide uh, case-based therapy, and this therapy could be integrative. But it sounds like there's a lot of other components that you have to know as a social worker before you can move in that direction. Like, do you have trust with the patient? Do you understand their social and environmental situation? And do you understand if that's how to effectuate that? And is that a cause of their condition, or is that an effectuator of their condition, or is it just solely they wake up one day and they don't realize it, but they're just depressed and they don't understand why they have major depressive disorder, but they do, and that would indicate, at least I'm not in the field, but it would indicate they have a genetic disposition to in a psychological disposition to and not a social and environmental. So this is how do you go about doing that? And is that something that you were trained to do? And is that something that's done in practice? So there's three important questions all in one. So I'm putting you on the spot, Ashley.
I would say to some degree, within your training and learning as a social worker, you are taught to think about the social and environmental circumstances. It's the idea of person and environment. And so basically, the emphasis is focusing on a whole person and looking at multiple factors, multiple things in their situation, and from there making an assessment of what they need. So that is the basis of what was taught to me in social work school. Does it always translate into practice is another question. And it can be hard. Sometimes yes, but sometimes we're all probably guilty of not putting it fully into practice. It depends also the environments that you're working in the setting. Some places it's a lot easier to do it. There are systems that are set up, whether it's documentation or the questions that you ask that really emphasize and connect to that. But then there might be other places where it's solely up to the discretion of the social worker, or it's completely up to them how they're going to get that information. And so sometimes you can miss things, especially if you're limited amount of time working with someone, or you've only seen this person for, maybe one time or two times. And so you're not working with them long term enough to have some details that you might be missing. Sometimes people, when they're recounting things, they forget things, or they're not comfortable sharing things from the beginning. So that's why that trust and rapport that you mentioned is really, really important, because if somebody doesn't feel comfortable or they can't trust you, they're not going to share probably some of the things that they probably should be sharing. So I think we're taught. I think it does show up in practice. It doesn't always translate, like I said, but you know, we try. I guess is what I can say.
So when you have to diagnose patients and you've diagnosed them with mental disorders, do you see a lot of people are that are impacted by social environmental that you feel affects the mental health disorder, or is it just people have generally a genetic or psychological disposition to that disorder?
I think you see both. A lot of times when clients come and see me, they do have stresses, they do have things that are going on that, are increasing symptoms. Every once in a while, I have a client that where there are no major stressors, everything is fine to them, but they are still having symptoms of whatever mental health diagnosis they are dealing with. Um, but I see a lot more of people being impacted by social and environmental. And when you think about all the things that we come into contact with, all of the things that we process during the day, all the things that we see, all of the things that we're exposed to, there's just a lot more information and a lot more things that we are exposed to. And that affects mental state, that affects mental health, that affects mood. So I think that also plays into a factor of why we see an increase in mental health diagnoses and people dealing with mental health disorders because there's just so much more that we're taking in. And we don't always know what to do with that stuff when we take it in. And so we're just filling up, filling up, filling up, filling up, and there's no release, there's no outlet or appropriate ways to then release what we're taking in. And so I think of course, social and environmental is very much connected to that because it's what we're exposed to, what we're learning, is what we're constantly dealing with day to day.
Sorry, so would you feel that social work would benefit from having more of a team-based environment across the healthcare continuum?
Absolutely, there are some team-based initiatives. And I know that I worked in settings where we had professionals of different expertise, and it was a lot of interdisciplinary work. But there wasn't always that closeness or that tightness that needed to be there to collaborate. Sometimes it wasn't as supportive as I would have liked it to be. And I just remember as a social worker, having a lot of moments of feeling responsible. I don't want to say I was responsible, but feeling responsible for large amounts of people. And that was a lot of pressure to live with, a lot of pressure to deal with. And, it does something to you, and that affects your ability as a social worker to show up because now you have kind of this added pressure. And whether you put it there yourself or somebody else puts it there, it's difficult either way, regardless of where it comes from. So I think having team-based approaches would help that of feeling less having some of that shared responsibility, right? That if this person is going through a difficult or stressful time, they have more than just me to go to. And, sometimes my clients would have other workers that they were working with, but they didn't feel like they could trust those workers. They didn't feel like, those people cared. And so, in those situations, then you kind of become the one that they can trust, they confide in, or they can talk to. And that's a really difficult position to be in. So, it's not just important for the social worker to have good relationships with clients, but it's important for the whole team to have good relationships so that if something's going on, it just doesn't fall on one person, but that it can go to anyone and anyone can step in and help.
So you're saying what would really help mental health is if people are in a health plan where they've gathered a lot of trust through the different healthcare workers versus just relying on hey, go to a mental therapist and talk to them, and they should provide the trust completely and provide that node, which would be very difficult and our healthcare system obviously has not done that so much, nor has it integrated psychiatry with psychology. I mean, you go see a psychiatrist, you generally, they're not talking to a social worker always, and that's been something I've heard. I don't know if you concur or not. I'll ask you.
I've heard it's been difficult to find a psychiatrist. I've heard that from quite a few people. And I think a lot of therapists in psychiatry don't exist in the same vicinity. So I worked in a place where it was in both the same building. And so it was very helpful and convenient for the clients that was on medication and also coming to therapy. So sometimes they weren't on the same days, and so that would create a little bit of inconvenience if somebody was taking the bus or had to find some other way of transportation and their appointments didn't line up. And that just was dependent on schedule and how hectic scheduling could sometimes be. But yeah, you don't necessarily see that always in a lot of settings and environments. That's what I found out.
So are you seeing the opportunity where primary care always has an interest in preventative care, but no one ever thinks of mental health being, or social determinants of health being a preventative care. Do you see an avenue where social determinants of health can have preventative care and where that would benefit?
I do see that, and there would have to be, in my opinion, some changes to the system, some changes to the way that we normally do things, and being able to say, okay, let's try something different, or let's try to do this on this back end and see if it helps. Let's put this into place. Let's give people the support before they, actually need it, or let's do some things to decrease some stresses. So I do think preventative care has its part. I don't think it'll necessarily prevent everything for everyone, but it's a start of being able to give some support and having that there as a foundation before people get into a crisis, before they're, full on having a hard time and struggling. Let's do some things in the beginning and see if we have less people getting to that point.
And so that's something you see within social determinants of health. Where do you see that social workers have learned how to effectuate social determinants of health, and also social environmental more generally, and that could be more put into practice?
I think most of where you see it now is macro social work. There is some in clinical, but there is a field of macro social work that most people don't really know about. And these are actually social workers that are committed to policy change. They do a lot of advocacy, they do a lot of work within organizations, but also a lot of work in communities. And so they're trying to tackle the much larger systems, the much larger social injustices and issues, and being able to get change on that front and get involved with government, get connected to helping make some of those changes, and being able to promote, the values of social work, which is, social justice and, being honest and self-respecting people, self-determination, those types of values. So there is that field of social work. It's not as popular as most people go into clinical social work, but it is growing, and I think it will continue to grow. And there's actually schools that have that as a subsection where you can choose clinical or macro, and that wasn't something that always existed. So I do think you'll see more of it grow. In clinical, you may see it on a lower scale, um, but you're probably not going to see it, on a very large scale, or it might be just individual choices that someone makes, but really not necessarily built into all of the work.
Well, Ashley, you're a therapist, so that's
Yes.
the majority of what you do is therapy. So one of the questions always become within social work and people that want to get therapy is they're told, how do they define if it's successful or not? And a lot of times therapy can take a long time. Um, what are your things that you think can be done within therapy that could help you as a therapist outside of the traditional meetings that would improve kind of the time constraints and some of the other aspects that you have to provide that therapy when you're not actually seeing a patient, and which can improve either outcomes or shorter periods of time, or at least teach you something.
I think the connections in between sessions. So the way that most therapy is set up these days is that you see a therapist, maybe it's once a week, maybe it's once every 2 weeks, and then there's that time in between, and then you would talk to them again that 1 week or at 2 weeks, unless you're having like some kind of conversation in between. But that's not typical and with time constraints. So I think it's helpful to have, kind of that communication or maybe even some coaching things in between so that as people are implementing the things that they're learning in therapy, they also have some accountability right there in the middle, in between of the sessions, and that they also have support in between. You know, they could call you right now if you're in therapy and you're struggling with putting something into practice. You could call your therapist, but most people probably aren't going to think to do that and say, "Oh, I'm struggling with what you told me to put into practice." They just will stop and then they'll wait until the next session and say, "Oh no, I couldn't do it. Uh, it didn't work." You know, so you kind of get that information after it's already happened. So having kind of that stuff in between can help with proactivity of, okay, where are you having challenges right now? Let's put that in place so that you can practice, and that by the time I see you, you'll be able to really give me an idea of whether it worked for you or not.
So to summarize, you'd really like to see more feedback and iteration between appointments that when you're working with somebody, and that would really help.
Yeah, it really would.
And now RADECT, we're kind of working on an alternative models for therapy so that we can increase access and make it a little bit more possible so that there's more kind of help in the therapy, but also learning more about the person and building trust across several different layers. And one of the key things is being able to also affect the social and environmental and focus on that a lot more and put a stronger emphasis there to see how that's affecting therapy. The types of things that if you had a lot more time with somebody, that would be really helpful. Can you describe what would be in your idea, in your mind, what would be kind of a good model if you could wave a magic wand and kind of do whatever you want? It doesn't have to be necessarily practical. And then discuss a little bit about what we're trying to do within RADECT that's different and what makes it kind of unique.
I think one of the things to definitely be able to work with more people and not be as exhausted. Um, So, sometimes the limitations in working in the social work field or working in therapy is the amount of people that you're working with. And the more people you're working with, the potential for, you know, more time constraints, more of that pressure that I was talking about as responsibility, more, potential for mental exhaustion, physical exhaustion. You saw a lot of social workers, this trend of a lot of people scaling back during the pandemic and saying I can't do necessarily the same amount of work that I was doing prior to the pandemic because a lot more people were dealing with, a traumatic situation and everybody was kind of dealing with it at once. And that's normally not what you would experience. So as this influx of people are coming in, you have social workers saying, okay, I need to work less. I need to do some things to protect my mental state. I need to do something so that I'm not exhausted and that I'm being effective for my clients. And so you have more need, and then you have um, more scaling back from the people that you need help from. And so, that can really create, um, I guess, this gap for people that now need support with the pandemic. I know it's a lot harder to find a therapist. I think it's gotten a little bit better, but I know in that first 2 years, the first year and a half of the pandemic, it was very, very hard to find a therapist, and everybody had a long waiting list. And being able to find someone was very difficult. And so I think with a model, if I could use my magic wand, would be that I'd be able to work with more people and not have to scale back because of exhaustion or because of time or because of other things, of being able to have that right. If I could reach more people and have a larger impact, that would be something really great to do. And also for resources to be up to date, and for the information to just be there. It'd be great if I could just pull up and know actually what resources are actually available in this person's city or close to where they live, and being able to get that information quickly and efficiently. There's just no efficient and quick way to do that. You have to do a lot of research. And so if you have to do a lot of research, then that's going to take away from the time that you're working with this person. That's going to take away time from maybe your personal life. It's going to take time away from something, right? And so if it was a lot quicker to find these things out, that would be helpful as well. I know with RADECT, of trying to make a change of just yoga instructors working with the clients or members more, so that way what the social worker or therapist is doing is still supporting, still assisting, still getting the information that they need, but that they also have the ability to focus a little bit more on putting those things in place and using the yoga instructor as a support of getting that information to people of, can you get this information? Can you, ask these questions? Can you start, using this to work with this this client? So it gives you some added support where you're facilitating the help, and it's not just all the help is coming from you. And then also having other professionals that you can facilitate help to. Hey, this person is having a lot of financial issues. I can go to a financial planner and get their expertise. I may know some things about diet, but I may not know exactly what would be helpful for this member that has anxiety. And I know that there's some health foods that can help decrease anxiety, or some things to stay away from that could increase fidgety and restlessness. So if I don't have that information, I can go directly to a nutritionist or someone that specializes in diet and ask them and get them connected to that. So that's, more of connecting with professionals that can have the expertise that can then help me to do what I need to do to help this member.
And what about tools that would necessarily help you during therapy? So basically things of worksheets and possibly, and we'll get into next question, getting into more futuristic about the internet to provide some resources as well through augmented reality, but or something a little bit more out there. But where do you see your ability to kind of say, okay, I want the patient or the client to go through worksheets and I want to direct them this way based on an integrative therapeutic approach, work on the X, Y, and Z, and then come back and then see what their thought processes are based on some of this information, and taking you through kind of steps. Do you see that these models have been developed? Because I know that groups like Beck Institute have created worksheets, and others, but they haven't really taken this into how can we do kind of a team-based model where we have someone like Ashley manage other people like non-traditional healthcare workers to provide that help. That could even be college students or intergenerational that are seeing aging population, seniors in their homes, and they might have some mental health issues or concerns about that.
Yeah. I may be wrong about this, but from my experience and what I've seen, that when it comes to worksheets, that is an individual thing that a therapist can decide. And so, I don't know if everybody uses them. I use worksheets, but usually you're having to do that research and having to pull from different sources. And I'm not sure how much of those worksheets are actually created by clinicians. And so that was something also navigating the mental health system and knowing that, sometimes documentation, how it was set up, the questions to ask, the worksheets, things that you would see developed, scales, all these types of things, of wondering how much are really created by clinicians. I know that there are some, but there's also a lot of information that's not created by clinicians, and then clinicians are the one using them. So, I think it's really important for worksheets and scales and certain things to be created by the people or have at least some input by the people that are directly working in direct care and are on the front lines working with the clients. So I think that that's really important to have clinician input because we see certain things that, maybe somebody else that hasn't been doing direct care doesn't see, or there might be something that's changing. There might be new trends. There might be new observations. And so it's important to get the current input of the people that are doing back direct care and not direct work.
That sounds like you're talking about a crowdsourced kind of using experiential knowledge and crowdsourcing that to the types of specifics that you want to practice for using the worksheets based on the specific type of similar clients, and saying this is what this would be used for, this isn't, and then therapists are actually developing the curriculum as you go for what would help people, and so it's not static either. It's something that's continuously improving.
Yeah, absolutely. Something that's changing, changing with the times, but, also there's a lot of misinformation out there about mental health. Um, and it's great that people are talking more about it. It's great that people are, expressing certain things in social media, but there's also the time of someone coming into therapy, me having to kind of re-explain some things to them or say, no, that's not completely accurate, or that's not everybody's situation. So, there's misconceptions, there's, information out there that just isn't true, and people believe it because it's what they see, it's what's on social media, it's what everybody's saying. So, there's also that factor. More information, but there's more potential for misinformation to be circulated in the midst of
it. So mental health has certainly become a buzzword, and most people that hear that haven't really gone through the DSM-5 and looked at what diagnosis would be, what treatments are, and spent the time actually going through what the processes are for therapists, and probably would take a long time for a therapist to actually describe what those are to a client or a patient in an appointment. It would take up an appointment. So what really is mental health, and what causes the misconception?
That is a good question. What causes the misconception? And I think with the internet, it's a lot easier for people to put out there that they're expert or to put out information and say, oh, this is fact. And because people are reading it, or because maybe a large number of people have read it, you start to think, oh, well, if other people are reading it, if other people are saying this, that it must be true. That's not necessarily the case. And in terms of what is mental health, even getting into the study about the brain, it's very fascinating. And so, sometimes it's making those distinctions. If somebody can have anxiety, doesn't mean that they're having a full-on anxiety disorder, or doesn't mean that they're having a full-on panic attack. So being able to make those distinctions, I think people use the words very loosely without taking the time to really understand what is it that's behind it. And so I find it helpful when I do explain that, it helps my clients and they say, oh, okay, like that makes sense, or oh, okay, that's completely different than what I've heard, or I've never heard anything about any of this. And so I think there's just a lot of words that are circulated around, and how many people are actually taking the time to research and really find out what the words mean, and putting them in the right context. That takes effort and that takes work. And we're in a world of instant gratification where things come to us so quickly that then doing research and trying to figure out what does this mean, that takes a lot more time that we don't set aside.
Because people always say, well, you're not, things aren't going well in your life, so, and we don't want to hear you complaining, so go talk to a therapist. And that's not the job of a therapist. That's more about coaching. And there's distinctions, strong distinctions of what the value is to coaching or some other disciplines that could help people versus an actual mental health issue, which is something that's actually a clinical diagnosis, which you could even end up with medication for. And and just closing thoughts, Ashley, since we've talked a lot about different topics and we've gone in different directions. Now that you became a social worker, you worked in Baltimore, and you've obviously worked kind of the gamut of course. Where do you see the future of social work heading? And I know this is kind of putting you on the spot, but where do you see that this field is heading? And I think people are trying to pull mental health into a telehealth tool. That's a quick, here's your 15, 20 minutes, quickly go through this. But talking to you, it seems like there's just a lot of data collection. There's gaining trust with people. There's so many facets that it's hard to even do something. And a diagnosis might take several sessions, and diagnosis is not easy in mental health. It requires really knowing the person, contextualizing what their understanding is, how they think. There's a lot going into that. And then in the intervention side, what you've described, there's a lot of nuances that you have to understand to help the person and see through what the types of things that's either helping them or causing them blocks. And maybe even from, if you're doing an integrative therapeutic approach, what are some of the things that are being more helpful than others? And then sometimes you're facing a number of difficulties. Someone might say, "Oh, I tried something and it didn't work." So you're almost having to teach them, "Oh, well, this is what we're trying to find," and you have to kind of educate them through the process sometimes. So there's just so much involved in just 15, 20 minute, 30 minute quick appointments. You do 6 sessions and everything will work. And that's been the problem inside mental health, is it takes a lot longer sometimes because of these factors. What would you say is that future of social work, and how would you see yourself wanting to be involved in it?
Yes, I will absolutely answer that question. I want to also say of what you were talking about. There's also human behavior and human choice, added in as well. So client self-determination, what do they want to do, and respecting that. So that adds another facet to what you were describing of when you're working with someone, of respecting their choices and respecting what they want. You may want something for them, or you may think something is best, but you have to respect their point of view and their choices and decisions. So, but for social work question, future of social work, I think telehealth is here to stay. It was going in that direction anyway, and the pandemic just sped that up. So I think telehealth is here with us, whether people like it or not. It's with us, and I think also, like I said, I think you're going to see more of macro social work expand. I think you're going to see that get larger, see more social work students getting connected to that and going into that section of social work, because of just seeing a lot of the barriers and saying, okay, we got to do something about this. Why can't social workers be at the table, so to speak? Why can't we be in the room when policy is being discussed? And so I know that there's certain groups that are very much motivated to keep that going. And so, like I said, I think you're going to see more people go into that sector of social work. And, in terms of everything else, I guess we'll have to see. I know another trend that I saw in the pandemic was people contemplating whether or not they wanted to stay in the helping professions, whether or not they wanted to stay in social work. And so I'd be interested to kind of see the data, in the next few years about how many people actually have decided to step away from social work. Right now, with the job outlook, it's anticipated that social work is going to grow as a field and that it's not going to get smaller. So, but it should be interesting to see if that actually happens, if the profession increases in size or if it decreases. So, I don't know. I think it could go either way, but I'd be interested in seeing the data.
Well, thank you so much, Ashley, for being on this podcast, and we really appreciate your time. Thank you so much.
Thank you.